Hello, welcome back to my channel. Today our topic for discussion is scapular anastomosis. So scapular anastomosis, that is the anastomosis which is present around the scapula. Okay, so why is this actually important? So this is one anastomosis which takes place between the first part of subclavian artery and the second and third parts of axillary artery, the branches of the second and third parts of the axillary artery. So in case of any blockage between this first part of subclavian artery and axillary artery, this scapular anastomosis will play a vital role in maintaining the collateral circulation to the upper limb. So it prevents the upper limb from suffering from ischemia. So that is the importance of this scapular anastomosis. Now let us label all the arteries to see which arteries are actually taking part in this anastomosis. Okay. So this is the first part of subclavian artery. First part of subclavian artery. Subclavian artery has got three parts. Okay. So this is the first part of subclavian artery, and this is giving off one branch which is called as thyrocervical trunk. Thyrocervical trunk. So thyrocervical trunk is one of the branch of the first part of the subclavian artery. Now this thyrocervical trunk, if you see carefully, it is giving off two branches. This one is the suprascapular artery. Suprascapular artery, and this one is the deep branch of transverse cervical artery. Okay, so I'm just repeating. So this is the first part of the subclavian artery. The subclavian artery, later on when it reaches the outer border of first rib, it will continue as the axillary artery. So this is again the axillary artery. So this is the first part of the subclavian artery. The branch of first part of subclavian artery is the thyrocervical trunk. This thyrocervical trunk is giving rise to two branches, that is deep branch of transverse cervical artery, and this is the suprascapular artery which is passing through the suprascapular foramen. So this is the suprascapular foramen. Okay. Next, we will see which branches of axillary artery are taking part in this anastomosis. So this is the thoracoacromial trunk. Thoracoacromial trunk, which is a branch of second part of axillary artery. Okay, and then you see this is the anterior circumflex humeral and this is the posterior circumflex humeral. These two are the branches of the third part of axillary artery, and this is the subscapular artery, which is again a branch of third part of axillary artery. Now this subscapular artery, it is giving off one branch. You see here, this is called as circumflex scapular artery. Circumflex scapular artery. Okay. So with this, we have named all the branches which are taking part in this scapular anastomosis. So where exactly do we see this anastomosis? So there are two sides for the scapular anastomosis. One is at the body of scapula. So this is the body of the scapula. So you have got anastomosis in the supraspinous fossa, infraspinous fossa, and subscapular fossa. Subscapular fossa is present in the anterior aspect. The one we are seeing here is the posterior aspect. Okay. So there is one anastomosis which is present at the body of the scapula, and you see one more anastomosis which is present over the acromion process of scapula. Acromion process of scapula. Okay. So first we will discuss what are all the arteries which are participating in the anastomosis at the body of the scapula. So if you have a look at this diagram, so you see, as I told you previously, this scapular anastomosis is between the branches of the first part of subclavian artery and the branches of the second and third parts of the axillary artery. Okay. So, the first part of the subclavian artery is giving of the thyrocervical trunk, and this thyrocervical trunk is giving rise to two branches, that is the suprascapular artery and deep branch of transverse cervical artery. So, along the body of the scapula, you see anastomosis between the suprascapular artery, branches of the deep branch of transverse cervical artery, and the subscapular artery is giving off one branch, that is circumflex scapular artery. And so these three arteries, they are participating in the anastomosis around the body of the scapula. So what are the three arteries which participate in anastomosis along the body of the scapula? One is suprascapular artery. Second one is deep branch of transverse cervical artery. And third one is circumflex scapular artery. So these three are the arteries which are taking part in the anastomosis around the body of the scapula, out of which first two are the branches of first part of subclavian, and this is the branch of third part of axillary artery. Okay, so here you see the anastomosis. Okay, next, moving on, we said there is one more anastomosis around the acromion process of the scapula. So what are the arteries which are taking part in the anastomosis around the acromion process of scapula? There are three arteries which are taking part in this anastomosis. So the first one you see is a branch of the suprascapular artery. Branch of the suprascapular artery. So suprascapular artery. Next, you see, this is the thoracoacromion trunk, which is a branch of the second part of axillary artery. So this thoracoacromion trunk will further divide into four branches which are placed at right angles to each other. Out of that, the acromion branch of this thoracoacromion artery will come and participate in the anastomosis around the acromion process. Okay, so this one. Okay, next, you see, this is the posterior circumflex humeral. So a branch from the posterior circumflex humeral will reach the acromion process, and these three will take part in the formation of anastomosis along the acromion process. So the second artery is acromion branch of thoracoacromion artery, and branch from posterior circumflex humeral. So of these, if you see, the suprascapular artery is a branch of first part of subclavian artery. Acromion branch of thoracoacromion artery is a branch of second part of axillary artery, and a branch from this posterior circumflex humeral is a branch of third part of axillary artery. So these three arteries will take part in the anastomosis around the acromion process of the scapula. So why actually this scapular anastomosis is clinically important? So when there is some obstruction at this level, okay, somewhere here in between the subclavian artery and the axillary artery. So this anastomosis which is there, it will act like a collateral circulation, and this will help to maintain the circulation to the upper limb, okay. So one of the important function of this scapular anastomosis is it will help to maintain the collateral circulation to the upper limb, okay. Next thing is one more clinical correlation of this scapular anastomosis is, so this axillary artery pulsations, they can be felt across by pressing against the lateral wall of the axilla. So if you have the axilla like this is the lateral wall of the axilla. So by pressing against the lateral wall of the axilla, you can feel the axillary pulsations. So because of this, if at any point of time you want to prevent the bleeding from this axillary artery, you can give pressure against the lateral wall of the axilla in order to prevent the bleeding, okay, from this axillary artery. And one more important clinical correlation is in a condition which is called as coarctation of aorta. So distal to this subclavian artery. So what will happen is there will be increased blood flow through this scapular anastomosis. So at that point of time, when there is increased blood flow through all these vessels of the scapular anastomosis, you see that the scapula becomes pulsatile. So you see a pulsating scapula because of the increased blood flow, okay, blood flow through all these vessels. So this is also called as pulsatile scapula, and sometimes it is also referred to as dancing scapula because it is moving with your heartbeat, okay. So these are all the clinical correlations of this scapular anastomosis. So with this, we complete the scapular anastomosis in total along with its anatomy and its clinical aspects. So those of you who haven't yet subscribed to my channel, please subscribe to my channel. Thank you all for watching.